Hello everyone, my name is Shafiq Rahman Masan and I am presenting at the 3rd International Multi-Topic Conference of Engineering and Science IMCES being held on 2nd and 3rd June 2020 at the Faculty of Information Technology, Universitas Yarsi, Jakarta, Indonesia. The topic of my presentation is an overview of AI-enabled MIoT wearable technology and its effects on the conduct of medical professionals in the public healthcare in Pakistan. My name, again, is Shafiq Rahman Masan, and my co-authors are Dr. Abdul Samad Dairi and Liaquat Ali Thibault. Right, the contents of my presentation are introduction, user assessment, and we'll go down up to the acknowledgement, and we'll see how the effectiveness, efficiency, and satisfaction of my results is predicted in this research. Right. The ongoing pandemic of corona has put a lot of stress on the healthcare, and healthcare is the backbone to the development of Pakistan and other countries. And there's a lot that can be done, such as smallpox, polio, bubonic plague in China, and healthcare can be enhanced by the use of massive IoT technology. Right? COVID is the newest and the most negative impact it has on the service, manufacturing, stock market, and its oil prices. And COVID has put a lot of stress on the international arena. Right? Healthcare before was in chronic crisis mainly because of doctor and nurses shortage and burnout of physicians and high demand for enduring care. Healthcare places a lot of stress on the physicians, and healthcare systems were never in such a desperate condition as per the COVID pandemic, and basic medical supplies are short, right? The healthcare system needs availability, accessibility, acceptability, and qualities of its healthcare workforce. The WHO in 2016 estimated the problem of aged workforce in the healthcare system globally by 17.4 million, and high frequency of patients and shortage of medical staff overloads physicians with increasing burnout experience. Right? As a result, lack of access to healthcare compromises the quality in healthcare facilities. 400 million people lack access to essential healthcare services, and 5 billion people do not have access to safe and affordable surgical and anesthesia care where needed. 9 billion people will need healthcare services by 2050. That is a global population that we are going to reach, while a staggering 142.6 billion need to be invested for developing countries' healthcare targets. The global healthcare is a $300 billion healthcare question that needs accurate spending. 20% of healthcare is wasted globally, and healthcare lacks efficient implementation and is virtually absent in the case of Pakistan. Right? We can see that due to the present pandemic, the COVID-19 pandemic, the forecast for global economic growth slowdown, it shows, the yellow chart shows the 2019 global economic growth and the 2020 old forecast in light blue, and the real forecast that is showing in dark blue, which shows that all over the world, economic growth shall be slowed down by a certain factor this year. Right? According to 2018 report, 90% of the global population lives in the rural areas, and this number will reach its peak by 2020. Life expectancies were worse, access to healthcare facilities are lacking, trained healthcare workers are lacking, there's difficulty in transportation, and there's a low quality of healthcare prevalent throughout the world. The costs of healthcare are skyrocketing, drugs are high priced, and hospital-acquired infections are growing, and the failure to deliver healthcare boosts adverse healthcare events. In Pakistan, the situation is not too good. The doctor-to-patient ratio is 1 to 1300. For every doctor, there are 1300 patients. and the doctor to nurse ratio is 1 to 2.7. So around for every doctor we have 3 nurses, right? And the nurse to patient ratio is 1 to 12411, which is very bad. And 22% of the patients are served through public hospitals, which is a staggering huge number. Right nowadays, the production, application, and utilization of information technologies marks the difference between the developed and developing countries. The workflow in hospital may be different. Healthcare services and scarcity of healthcare resources may be different, and working conditions are uncertain, unscheduled, and care decentralized. So, in the present COVID 2019 pandemic, we need the utilization of information technology. The healthcare information technology development holds the potential to improve healthcare quality and accuracy in emergency, safety, medical errors, efficiency, and patient care. Therefore, immediate innovative intervention is required in rural areas of developing countries. This was again the research by Diary, previous research by Diary. Managers could use medical equipment and new technological tools to improve patient safety and satisfaction. Now, the main question is that hospital information systems accompanied with gradual advancement of software, hardware, and new methods in order to enhance agility and quality of healthcare services is growing. The increased population and scarcity of healthcare resources necessitate the adoption of wearable IoT services as a best solution in terms of cost and efficiency. IoT is again Internet of Things, in which devices are available on RFID and uniquely identifiable because of their IP address and reside in the RFID, radio frequency identity technology. IoT basically observe interconnectivity of devices as data sources through existing internet infrastructure. So if a person is wearing an IoT-enabled device, it can not only reduce errors, increase agility and accuracy in healthcare quality, but also if you integrate AI, artificial intelligence, into the MIoT, massive IoT technology, then we are able to provide better healthcare services as well as better diagnosis by processing the particular data on a data center and giving the physician only that information that is required at the moment. So if there's an abrupt change in the patient's healthcare or any problem, the services may be enhanced and may be forwarded, given to the person when the need arises. We must recognize the importance of IoT integration if we are to meet the huge demand in healthcare and to improve quality and reduce cost of emergency department and related provisional units in hospitals. So the patient does not need to go every time, but IoT-enabled artificial intelligence devices shall make sure that the patient gets the quality healthcare whenever he is in need, right? The number of IoT-enabled devices is rising. As the graph shows, it's an exponential graph. And this is how the number of IoT-enabled devices are growing year by year. And by 2025, 75.44 billion devices shall be connected. IoT-enabled devices shall be connected. IoT brings rich user experience, connectivity, reliability, and smart healthcare services to patients, which leads to smart healthcare, smart, specific, measurable, and of course, the rest of the acronym people know, right? People can get smart functionality, remote server, and the network to remotely monitor patients. 76% healthcare professionals believe that IoT will transform healthcare industry to a great extent. The mobile technology provides grounds to IoT by using smartphones. Smartphones can be used, wearable watches, digital watches, IP connectivity with low power consumption, security, apps, or through healthcare system. Mobile computing is a new trend, and the mobile phone has a sufficiently powerful processor that can provide quality healthcare, quality processing, storage information query to the users at remote geographical areas. IoT serves as an intelligent sensing technology that supports virtually in sending and receiving mobile medical data. Mobile healthcare applications are prevalent and they are used for the diagnosis of diseases, the drug references, and medical computations. And the most important use of mHealth applications is personalized health system, where various sensors in the mobile, such as gyroscope, accelerometer, altimeter, general packet radio services, 4G systems, GPS, and Bluetooth technology, collectively help monitor, diagnose, or even forecast health risks at a distance. These sensors in MIoT devices can be attached to the body of patient, to the ankle, to the wrist, and the chest, and collect data through mobile app and send it to the respective department or to the doctor concerned. Right? As we can see that the doctor is receiving the information from the mobile phone, whereas the data center is processing the patient's data throughout the day, throughout the year, and feeds only that data that is relevant to the doctor. The patient is wearing a mobile device or a watch that is looking at his vitals, and the user gets health information from data center, and the user is delivered quality healthcare by the doctor as and when it is required. So wearing a MIoT wearable smart healthcare system is the choice, the first choice to get better healthcare at a reduced cost, right? The applications that can be put into a wearable device are not limited to glucose level sensing, blood pressure monitoring system, body temperature monitoring system, oxygen saturation monitoring system, electrocardiogram monitoring system, and the cluster condition applications are wheelchair management system, rehabilitation system, and healthcare solution using smartphones. Right, the population for the study was about 450 people, 470 people, and the female ratio was 74% and the male ratio was 36%. Graduates were 68%, undergraduates were 42%. Right, and the work experience was ranging from 2 years to 40 years in the field of Sindh province of Pakistan. Validity was of two types: convergent validity and discriminant validity that was used. Right, and the PE, EE, SI, BI, BU values are tabulated in this table as follows. Right, here at all recommended R2 standard beta T values via bootstrapping technique on 5,000 samples for predictive relevance Q2 and effect size F2. Moreover, confidence intervals values are also taken into consideration, which ensures the confidence of same response from the same sample of target population as revealed in table 2 below. Right, the table 2 above reveals that P is significantly related to BI, EE is significantly related to BI, SI is significantly related to BI, PI is significantly related to UB, and BI is mediated between PE and UB. BI is mediated between EE and UB, and BI is mediated between SI and BU. So the PE in the end had the effect of size of 0.267 on BI, and EE had effect of the size of 0.248 on BI, and SI had effect size of 0.152 on BI, and BI had effect of size of 0.251 on BU. The results of the structural model assessment are as tabulated in this table. Right, the test for predictive relevance by blindfolding procedure for goodness of fit was followed as shown in table 2. These values were found above 0, 0.139 for BI, and 0.238 for BU, which according to Henseler Ringel and Sinkovics shows model had good predictiveness as bearing to value above 0. Right? The aim of this study was to show that the use of technology adaptability is good for AI-enabled IoT wearable devices. And the overall model was found to have 52% variance. It was acceptable, and the intentional use of technology was encouraging. The study reveals the mediating effect of intention on the use of technology between determinants and the behavior to use AI-enabled M health applications. Right? Social influence in Pakistan was low, and people were reluctant to use technology, and the country was not supportive. And in Pakistan, the social influence was lesser. The technology, this is because in Pakistan, technology is less trusted and still rely on physical method of getting treatment for diseases or diagnosis. Technological advancement is necessary if we are to get the best medical healthcare services. Technology adoption is the main key, and UTAUT determinants on behavior intention of medical professionals to use the new technology in medical healthcare system show the usefulness of UTAUT model to assess the behavioral intention towards the use of massive IoT use to provide additional contribution in the literature. There are certain limitations, and we had focused only clinicians and focused only the public healthcare sector, which is less likely to adopt technology. Cultural and social dimension must also be included if we are to carry out these studies. So in the end, I'd like to thank everybody and say thank you. And it is shown that the use of massive IoT devices is the future of healthcare in the countries all around the world. Thank you.